Hello world, Fibro world. It's probably been a while since I've updated. It's been a wild ride. I am currently on my Peloton doing my 1 mile ride. Today's been rough. It's the afternoon and it's been rough. So I am really working on getting on the bike for 1 mile every day. You know, 1 mile doesn't seem like a lot, but it's enough to maybe help. I don't know. Just trying to do what I can. It's been a while since I updated. I've been on gabapentin 100 milligrams at night consistently, and it's helping with the sleep aspect. It's not the best, and it's not really helping in any other areas, but at least I'm sleeping better. I started this new treatment called Neuragenex. It's mostly for like older people who have neuropathy. You know, they call themselves a pain management clinic, but they don't prescribe pills. They have this new innovative treatment plan. All right, well, here I am. I did like 6 minutes on my bike and I'm at a mile. So I am gonna stop there, even though I feel like I could probably continue going, but now I just need to get out of my bike. I'm not gonna push myself because this is what I do. I feel good, I push myself, and then I feel like crap, and I don't do it for another month. So anyways, so I've done 2 rounds of the Neuragenex treatment. So it consists of high electrical, like, the best way to describe it is like a TENS machine, but a TENS machine is really for temporary relief. The machines that Neuragenex uses is for chronic pain. Oh, I'm out of breath. You can tell how bad of a day it is. I'm out of breath. So, I feel like I'm fortunate enough that I'm close enough to a location to try this out because there's only a couple in the country. It's only in a couple states, and I think our area has 4 locations, and they're opening more, but the opening process has been delayed for a lot of the other locations. So it's about a 30-minute drive from my house there. They recommend treatments twice a week where you get this high electrical stimulation. And because I have fibro, mine are placed along the spine, and it's supposed to help with regenerating the nerve. And then once a week IV therapy. So the first session was a consult with the doctor, and I felt seen and I felt heard. And I started my treatments right away then. They did blood work. And then the second session that I had yesterday, they did a couple more different tests. They did like an autonomic nervous system test. They did a lung function test and a balance test. So, and then I got an IV yesterday. And my IV consisted of 250 milliliters of like an IV bag, which is just, you know, like fluids. And then they pushed B12, folate, vitamin C, and an amino acid. I was supposed to get taurine, but they were out of it. So once a week you get an IV therapy. Next week when I go, I'll get the results of everything. But I was just blown away by the doctor because he completely I gave him pretty much a very thorough history of everything that I've experienced in my life, all the issues and all the diagnoses, and he got it. And he was like, yeah, we can help you. There's definitely something going on there. So I'm really eager to see what And I'm curious to see about the autonomic nervous system testing, because I think I have POTS. And from what I saw, it said something like my heart rate went from 70 to 136. So I think that qualifies for a POTS diagnosis. If not, it's very, very close. Yeah, so I'm going to do 6 weeks of treatment, and then they will reevaluate. And next week when I go, I will get all the results and kind of, he did a lot of different blood tests that my normal physician did not order. So did a lot of hormone testing, which I'm very excited to see how everything is looking. He recommended some different supplements. So he said, I need 3,000 milligrams of vitamin D. He recommended taurine, which my Amazon package just came, so I got to go get it. He said continue with the prebiotics, but he said, no, continue with probiotics, but I needed to add a prebiotic. So I ordered some inulin. So I think I can just add it to yogurt, or I don't know, just add it to something maybe. I think he recommended adding it. He recommended adding it to coffee, so I'll have to look into that. Yeah, I don't know. It's been difficult. I've been feeling horrible, and I've been setting those boundaries. It's the holidays, and you just have to set your boundaries and what you can do. So I will keep you posted on how this treatment goes. I don't know. I'm hopeful that it's going to work, or that it's going to help. There's no cure, but is it going to help alleviate some of the symptoms? Can I get through this? So, okay. I'm gonna get some water, because now I'm thirsty, and go get my Amazon package. I will update you guys soon. Happy New Year.